What happens to your body when you eat yogurt every day is a question many people ask, especially once they pass the age of 60. Yogurt is often seen as a simple, harmless food, something light, comforting, and easy on the stomach. Many seniors turn to yogurt believing it supports digestion, strengthens bones, and keeps the body balanced as it ages. But when yogurt becomes a daily habit, especially when eaten consistently over months or years, it can begin to influence the body in ways most people never consider. Some of these changes can be beneficial, while others depend heavily on the type of yogurt, how much you eat, and how your aging body responds. This is something I've observed repeatedly in older adults over the years, and I want to share what really happens beneath the surface. I'm Dr. Nancy Weller, and this is based on what I've seen in aging bodies and long-term dietary patterns. As the body ages, digestion becomes more delicate. Stomach acid production decreases, enzymes slow down, and the gut becomes more sensitive to what we eat every day. Yogurt is often recommended to seniors because it feels gentle and easy to digest. When you eat yogurt daily, the first noticeable change often happens in the digestive system. Yogurt contains probiotics, which are beneficial bacteria that help support gut balance. For many older adults, this can lead to smoother digestion, more regular bowel movements, and reduced bloating, especially if digestion has been sluggish. However, the gut of a 60 or 70-year-old is not the same as it was decades earlier. While probiotics can be helpful, the type and amount matter greatly. Eating yogurt every day can shift the gut microbiome, sometimes in positive ways, but sometimes in ways that create imbalance. Not all yogurts contain the same strains of bacteria, and many commercial yogurts are heavily processed. Over time, certain probiotics may dominate while others diminish, which can affect immunity, nutrient absorption, and even mood. Another major effect of eating yogurt daily is related to calcium and bone health. Yogurt is often praised for its calcium content, which is essential for maintaining strong bones as we age. For seniors concerned about bone density and fracture risk, daily yogurt consumption can help support calcium intake. This can be particularly helpful for those who struggle to consume other calcium-rich foods. Combined with adequate vitamin D, yogurt can play a role in supporting skeletal strength. But there is an important detail many people overlook. Calcium absorption depends on overall digestive health and mineral balance. If yogurt is consumed daily but replaces other nutrient-rich foods, or if it is paired with a diet high in sugar and low in magnesium and fiber, the benefit to bones may be less than expected. In some cases, excessive reliance on dairy can even interfere with the absorption of other important minerals. When you eat yogurt every day, your protein intake also changes. Yogurt contains protein, which is important for maintaining muscle mass in older adults. For seniors dealing with muscle weakness or gradual muscle loss, yogurt can contribute to daily protein needs. Greek yogurt, in particular, is higher in protein and can help support satiety and muscle maintenance. However, dairy protein behaves differently in the aging body compared to plant-based proteins. Some seniors digest dairy protein easily, while others experience silent intolerance. This can show up as mild bloating, mucus buildup, joint stiffness, or fatigue rather than obvious stomach pain. Because yogurt is considered healthy, these symptoms are often ignored or attributed to aging itself. Another significant factor is inflammation. Aging naturally increases low-grade inflammation throughout the body. For some individuals, daily yogurt consumption can help reduce inflammation due to its probiotic content. For others, especially those sensitive to dairy proteins, it may quietly increase inflammatory responses. This can contribute to joint discomfort, skin issues, or persistent low energy without a clear cause. Blood sugar regulation is also affected when yogurt becomes a daily habit. Plain, unsweetened yogurt has minimal impact on blood sugar and can help stabilize glucose levels. However, many yogurts consumed daily contain added sugars, flavorings, or sweeteners. Over time, this can contribute to insulin resistance, especially in older adults whose blood sugar regulation is already more fragile. What seems like a small daily serving can slowly influence metabolic health. Daily yogurt consumption also affects cholesterol levels in subtle ways. Some studies suggest fermented dairy may have a neutral or slightly beneficial effect on cholesterol for certain individuals. However, full-fat yogurts contain saturated fat, and when eaten daily, this can accumulate in the diet. In aging bodies with reduced metabolic flexibility, this may influence LDL cholesterol and cardiovascular risk over time, depending on individual response. There is also the matter of lactose tolerance. Many seniors become less tolerant of lactose as they age, even if they had no issues earlier in life. Yogurt contains less lactose than milk because fermentation breaks some of it down, but daily exposure can still cause low-grade digestive stress in sensitive individuals. Symptoms may include gas, bloating, or a heavy feeling after meals, which often go unrecognized as dairy-related. Eating yogurt every day also influences appetite and food variety. Yogurt is filling and convenient, which can be helpful, but it may also reduce hunger for other foods. Over time, fruits, vegetables, legumes, and whole grains may be eaten less frequently. This can lead to reduced dietary diversity, which is crucial for gut health, immunity, and long-term vitality in older adults. Another overlooked aspect is how yogurt interacts with the immune system. The gut and immune system are closely connected, especially as we age. Balanced probiotics can support immune resilience, but imbalance can have the opposite effect. Consuming the same type of yogurt every day may limit microbial diversity in the gut, which is increasingly recognized as important for healthy aging. The way yogurt is consumed also matters. Yogurt eaten alone may digest differently than yogurt combined with fiber-rich foods like fruits, seeds, or whole grains. Without fiber, probiotics may not thrive as effectively in the gut. Fiber acts as food for beneficial bacteria, and without it, the long-term benefit of daily yogurt may be reduced. There is also the issue of protein balance. While yogurt contributes protein, relying on it heavily may limit intake of other protein sources that provide different amino acid profiles. Aging muscles often respond better to a variety of proteins rather than repetition. Some seniors eat yogurt daily, yet still experience muscle weakness and slow recovery, not realizing variety plays a role. Daily yogurt consumption can also affect hydration and electrolyte balance. Yogurt contains sodium, and when eaten frequently, this can contribute to fluid retention in some individuals. For seniors with blood pressure concerns, this is an important detail that often goes unnoticed. Long-term habits shape how the body adapts. Eating yogurt every day is not inherently harmful, but its effects accumulate slowly. Many changes occur beneath awareness, which is why people are often surprised when digestion, energy, or lab results shift over time. What matters most is individual response. Some seniors feel lighter, more regular, and more comfortable with daily yogurt. Others experience subtle inflammation, digestive stress, or metabolic changes. The body's response after 60 is highly personal and influenced by genetics, gut health, activity level, and overall diet. The aging body thrives on balance and variety. Yogurt can be a supportive food when used thoughtfully, but when it becomes a rigid daily habit, it may crowd out other nutrients the body needs. Seniors often do best when yogurt is part of a broader pattern that includes fiber-rich plants, adequate hydration, and diverse protein sources. Many older adults who adjust their yogurt intake, choosing simpler varieties and varying frequency, notice improvements in digestion, energy stability, and overall comfort. These changes are gradual, which is why they are often overlooked. Ultimately, what happens to your body when you eat yogurt every day depends on the type of yogurt, the amount, your digestion, and your overall lifestyle. Yogurt is not a cure-all, but it is not an enemy either. After 60, supporting gut health, bone strength, energy, and independence comes down to understanding how even simple foods interact with a changing body and choosing balance over routine.